Because when you think of it, there's nothing more important than health. Doesn't matter how much money you've got, doesn't matter how many possessions you've got, it means nothing if you don't have health. So let's talk about health. And what I want to talk about is the global epidemic of non-communicable chronic diseases. The World Health Organization recognizes this as the leading cause of death around the world. The thing is about these diseases, and these are diseases such as heart disease, stroke, cancer, we can't get them because we're sitting next to a person with them. You're not going to get cancer because you're sitting next to a person with cancer. These are diseases that we know come from lifestyle and environment. That's actually good news because that means we can prevent them by changing our lifestyle. That's one of the things that's very important about this conference. We know that food is a very important part of this epidemic. But we also know environmental exposures are. And the ones which are most underreported but have a big role in this epidemic: radiation, which we've heard about from speakers, but also chemicals and pesticides. The issue of chemicals and pesticides is largely ignored when we look at this epidemic, even though we have a lot of science to show their role. The reason why it's largely ignored is because our authorities will say all the pesticides, all the chemicals have been analysed by good science and they are safe. Trust us, they are safe. Well, let's look at this science. Well, the truth is, now there's actually more than 100,000 chemicals since I wrote my book. Get more and more all the time, and less than 1% are actually scientifically tested. The vast majority of chemicals we are exposed to have zero scientific testing. New chemicals are made every day and put out there in the environment. They turn out also in our bodies with zero scientific information. Pesticides are one of the few groups of chemicals where there is some testing. So let's look at it. When a farmer uses a pesticide, it is a formulation. It is a cocktail of different ingredients. One they call the active ingredient, the others they call inerts. These inerts aren't inert, they're added because they make the active ingredient work more effectively. Some of them are solvents, others are adjuvants. They have a range of roles, but when the company, the pesticide company, submits the pesticide for testing, they only have to nominate one of these ingredients. And usually, that one ingredient is less than 5% of the mixture. A lot of times it's less than 1% of the mixture. And yet there is an assumption that just by testing this one ingredient, that the toxicity of this one ingredient is the same as the toxicity of the cocktail of ingredients that is sprayed on our food. That is what we call a data-free assumption. In other words, there's no evidence, scientific evidence, to show that this mixture has the same toxicology as the one ingredient they choose. It's a scientific nonsense. And where we do have independent testing in the peer-reviewed literature, and the peer-reviewed literature is the gold standard in science, these chemicals are usually hundreds of percent more toxic. Some of these formulations, and the reason I keep on calling these formulations, these are the actual products used by farmers, not just the one ingredient that is tested. It's the actual product. So sometimes they test the actual product for acute toxicity. This means the amount of chemical that once you're exposed to, you will die within 2 weeks. In other words, if you have an exposure and in that time you die, then that is recorded or looked at, and they work out the safety rate. That's very good to prevent people from dying from it, but it tells you nothing about long-term diseases. Cancer takes more than 2 weeks. Heart diseases take more than 2 weeks. Stroke takes more than 2 weeks. Birth defects take more than 2 weeks. Here in the United States, there's about 1,400 of these formulations that are registered. My country, which actually has one of the worst regulatory authorities, we have 7,200 chemicals that are registered. And not one. There is no testing for reproductive effects, for birth defects, for cancer, for all the chronic diseases we see in our society. So the reality is this. There are thousands of formulated pesticides that are used in the production of our food, and not one has been scientifically tested for the actual long-term chronic diseases that we suffer from, which is an epidemic. So that's why I termed, my first book was called The Myths of Safe Pesticides, to show that this safety of pesticides is a myth.